Hi there, this is the first of two videos on the topic of summarising, signposting and acknowledging. These are key skills in the history taking, data gathering section, and they check the accuracy of what you think you've heard, enables a structure for the consultation so you remain in control, keeps the patient involved in the consultation, and is also really good for time management as well. So summarising is something you can do at any time during data gathering if enough information has been received that either you could have interpreted it incorrectly or you need time to kind of formulate your thoughts. If there is lots of chunks of history during a complex consultation, you may need to summarise 2 or 3 times during that consultation. In most consultations, however, you would usually get the bulk of your information, most of your information, from the early open questions, and then you would summarise all that information. There are several benefits to this, as well as checking understanding. It gives you some thinking time to organise your thoughts, and it also demonstrates to the patient you've been listening, acknowledges that you have heard them. Most doctors are okay with the summarising the medical side, so remember to also always summarise any illness information you've had. That's the impact of the illness on the patient, how it's affected their life, what they've told you from that regard, any ideas, concerns, expectations the patient has revealed to you with the open questions. You don't need to summarise all the time, so you don't need to summarise if there is very little to summarise. If the patient has said to you, I banged my knee a week ago and it's a big bruise came out and it's not getting any better, you don't have to just repeat back what he just said. Signposting is the act of keeping the patient informed of what is happening at each stage in the consultation, and maybe wider what's going to happen later on or at different stages. You can put a signposting sentence in front of summarising. You don't have to do this. You could just, rather than asking another question, just start summarising. Or you could say something like, so from what I understand, and then you can start summarising. And I would usually do something like this if I'm fairly confident I've understood what's happened. If I'm not quite so confident, I might say, can I just check that I've got this right? Because that kind of sets up that maybe there might be some mistakes there, and then I'll go on to summarise. Sometimes you're given a lot of information, and or it might be a bit complex, so you don't really feel you've understood parts of it. If you're pretty sure that's happened, and when you summarise you will be making some mistakes, it's good to make that clear to the patient, because if you just start summarising and the patient has to repeatedly correct you, that's going to dampen down their confidence in you. So you could say something like, there's a lot of information there, I think I understood most of it, but I'd like to check this, and please interrupt me with anything that isn't quite perfect. And then as you're summarising, you could make it clear any bits you think you're not sure on. So say, I wasn't sure about when that swelling first started, or and then you noticed the swelling, was that a week ago? And at the end of the summarising, the patient needs a chance to agree or not, although normally they would have disagreed while you were going, but a little pause at the end, or a simple question, is that correct, or have I got that right, is sufficient. What question you ask next obviously depends on the consultation. I often ask another open question. It gives me more time to think about what's going on and organise my thoughts. So something like, is there anything else about all this? Or I might specify about the knee pain that we haven't covered yet. And this gives the patient another chance to get anything off their chest. So putting all this together as an example, we might have something like, can I just check I've understood correctly? So you had knee pain about 3 years ago, lasted for about 2 months. It went away completely without any treatment, but this feels the same, started about 4 months ago, but this isn't getting better despite giving up golf. You tried to play golf, but it was painful, you weren't being able to play properly, and that hasn't helped, and you took some ibuprofen, that hasn't helped either. And you could pause, or you could ask is that all correct? And then is there anything else regarding the knee pain we haven't covered yet? And at this stage, I would usually move on to an ICE question, because I feel like I've got a pretty good idea of what's been going on. And the window I might use for this is that the patient has said about there was nothing obvious that he thought had caused it, so they'd obviously thought about it, so I might use that. You said it wasn't obvious why it started. Did you have any thoughts that crossed your mind as to a reason, or thoughts as to what you thought might be actually wrong with the knee? So acknowledgement is saying something that shows the patient you have heard what they are saying. Summarising also functions as an acknowledgement for that reason, but you can also make specific acknowledgement statements during the data gathering stage. And this can significantly improve your time management, because some patients will continue to tell you the same thing until you demonstrate you've heard them and you are going to do something about it. So for our knee pain guy, he might tell us different situations where the knee hurts, or he might repeatedly tell you how upset he is about not being able to play golf until you acknowledge this. A skill that comes with experience is when to identify when you're no longer receiving new information that's going to help with the management plan, and that's the point to get your acknowledgement statement in to then move the consultation on. The acknowledgement could be a summary, like we said, and it could be a sort of mini summary with an empathic statement, and it could be a hypothesis of how you think the problems impact the patient, or maybe a hypothesis on what you think might want to be done next. If there was more, usually it's a combination of these, if I felt there was more of a psychological element to what had been presented, I would do a short summary and then give an emotional empathy statement followed by a pause. So you could play golf despite the pain, but not like you'd like, and it does hurt after you played. Sounds like not being able to play golf now is having quite an impact on you. Empathy statements with a pause act like a question, because the patient will then fill in a response if you give them a chance, either with, it's hypothesis, so either they would confirm or deny, and if they confirm, they may probably then go on to tell you a bit more about how they're feeling, or maybe some social aspect of what's going on. If I didn't feel like there was a psychological component, then I would do the little summary with a signpost that we're going to do something about it. So something like, so you play golf despite it being painful but not like you'd like, and then you've had to give up. I agree, 4 months and it not improving, and the way it's impacting on you, I think that's long enough and we should be doing something about it. So in a minute what we'll do is have a look at what we can do next. And if you pause after this statement just a couple of seconds, see what patient fills in. The patient may volunteer some expectations because you've just brought up you will be doing something, and the patient might say, oh yes, I want an x-ray, or whatever it might be, or want some painkillers so I can play golf. Summarising, signposting, acknowledging are all tools that enable transparent consulting. So this is involving the patient in the consultation, so both you and they know what is happening at each stage, and maybe even what's going to be happening later. You might signpost to inform the patient what you intend to happen in the consultation, like with the last example. Signposting can also be used to inform the patient about why you're asking the next set of questions. If the patient knows why you are asking the questions, the information you're getting back is more likely to be accurate. And the transparent consulting videos on this channel are all about signposting to inform the patient why you're asking these questions. You only need to do this if it's not obvious why the question is being asked. So, for example, early open questions usually do not need an explanation. Many of you will already do this to introduce sensitive questions, like sexual history. Have a think about what you actually say, and have a think, can you make this more transparent? So pelvic pains can be caused by sexually transmitted infections. Is it okay if I ask you some maybe sensitive questions around that area? So this is better than just saying, can I ask some sensitive questions, without stating why. patient is not making an informed choice if they do not know why you're asking the questions. They may say yes, what choice have they got? But in their mind they'll be going, well, yeah, but what's that got to do with anything? With our knee pain example, when we summarised and signposted that we will look at doing something with his knee, the next statement could be another signpost. So first though, I would like to ask a few questions looking for reasons why this knee pain might have developed. Do you have any problems with any other joints? Then you might ask about things like family history in this section. Effectively, you're saying this isn't about the knee itself, but there is a good reason for these questions. And this is better than what I've seen a lot of times. Is it okay if I ask some more questions? Of course it is. That's why they've come to see you. But just by asking that question doesn't help the patient understand why you're asking it. The other way Signpost improves things is with time management by making the structure clear. So if the history went off track, you can easily bring it back again if it's been clear what the purpose of this section was. So our knee pain example, if it gone off track, we can acknowledge and then bring it back. No problem, we can discuss a sick note at the end. Now let's carry on looking for reasons why this knee pain might have developed. Do you have any family history of any joint problems? And this also helps you feel like you're in control. You have the ability of structuring and so taking control of the consultation. Asking for a timeline at the start of the consultation is another example of signposting. Watch that timeline video if you haven't already, because I think it's really useful. During the timeline, you may inquire about a specific symptom, or the patient might take you off on an avenue. It's then easy to bring that consultation back. Great, thank you for that. Now then, what happened next after the swelling you had last week? So, in summary of summarising, only summarise if there is a purpose for it. Give the patient the opportunity to tell you it's wrong. If you think that might happen, make it clear to maintain rapport. Acknowledge to help move the consultation on. Signpost to keep a structure and to enable the patient to understand what is happening, and always pause after an empathy statement. Okay, I think the next one's going to be a bit shorter.